This is a taped recording of one of our Welcome to Pregnancy Care virtual sessions. We hope you find this helpful as you begin your pregnancy journey with us.
So we did our little virtual tour. We're going to go into what we offer you, and then we'll go into what you can do for yourself. I'd like to let you know also that this is not a childbirth education class. This is not a class about how the baby's going to come out. This is about the pregnancy part and how you can participate, what we do for you and how you can participate in assuring a healthy pregnancy and birth process as well. We are working on childbirth education classes also in this type of format. Be patient with us. In the clinics, there are flyers that will give you links to options that are available. What we offer you. So we talked about the clinics. There's the YPO Medical Office, Honolulu, and Ko'olau. So again, to Maui people, this is geared towards Oahu. You can get your care at any of those 3 clinics. So if you need a same-day appointment, you can call and they will find a provider that's available. We always have urgent appointments Monday through Friday that are available at all 3 clinics. Same with ultrasound. Sometimes they will shift you to a different clinic for your ultrasound. We have one hospital. It's Moanalua Medical Center. It is a bit of a turnaround to get here, so I do recommend at least a drive past, just so you're familiar with how to access our care. You would pull into our main parking lot area. If you're in advanced labor, you're going to want to just pull in and drop her off. There are usually wheelchairs outside. If you can walk and you're fine, you can pull into the parking garage and make your way up to us. We do want you to call labor and delivery first. That number is on the screen, 432-8550. That gives us a heads up that you are arriving. We will have your chart open. Usually we've reviewed it before you come in, and we'll also have a room ready for you also. Okay.
Jeb, another question. Do you have any update on when those childbirth classes might be up and running?
John is working on one. What do you think, John? He'll probably answer in chat.
Oh, hey guys, sorry. Probably at the, we have 2 nurses looking at the curriculum right now, the material. So I'm hoping by the end of September they'll be up to speed with on how to use Teams and how to present the materials. So yes, I'm hoping by the end of October.
Wonderful, thank you. Good question. So we did address the COVID with the necessary changes to keep you safe. We also look a lot different. So you will notice in these wonderful slide photos, smiling faces at you. Now we are masked and usually have eyewear. In the clinic, you're probably already seeing that. The first person that you will come in contact with at the clinic is the medical assistants. They're the ones doing your blood pressure, asking initial questions, checking your weight. We also have LPNs, registered nurses, who are mainly the voices on the phones. If you call in or if they need to call you with results, advice, they actually will check our emails if we're not in clinic. They'll be reviewing those. They may invite you to call. They will do IVs and schedule appointments and sometimes injections as well. The nurse managers are very much behind the scenes, but they keep us going. They're the nursing leadership that advocate for our department, and they make sure everything runs smoothly. And also at clinic, we've got the OB technicians who are doing your dating ultrasounds. So for scheduling appointments, the 432-2000 number is the best way to schedule, and try to come a little early right now, just because our social distancing in the lines, as well as check-in, might take just a little bit longer as you're getting your temperature checked. We have appropriate social distancing in our waiting room, so you'll see the chairs are all separated and spread out right now to keep you safe. The clinic providers, the obstetrician and gynecologist, those are the OBGYNs, the doctors. We have nurse practitioners. and women's health, certified nurse midwives, the perinatologists, genetic counselors, and then we have Kupa Ola, who is the diabetes and pregnancy program. They used to do a group initial visit, and that has also switched now to more of a Teams meeting too. I will go into more detail about the differences between a nurse practitioner and certified nurse midwife. Nurse practitioners, just in brief, tend to be women's health in the clinics. Certified nurse midwives, we're also baby catchers. So that's the difference. We're at the hospital too, but there'll be more. Your hospital team also does not have a smiling face right now that you can see. The smile will be in our eyes. We are masked. We have the hospital ward clerk who is there when you come into labor and delivery. So when you've made that first phone call to labor and delivery to say you're coming in, you do not need to check in at the first floor. You just go directly to the 6th floor to the either labor and delivery or postpartum, if that's where you're coming, and check in upstairs. So you do not need to go to the kiosk downstairs. The ward clerk will be the one to check your ID and also your Kaiser card and be your initial contact. The ward clerk is also the one on the phone. So that 432-8550 number will always be answered by a person, usually our ward clerk, and then our nurses or providers are available if a question is needed. The registered nurses are here and work as a team. Nurse aides, we also have operating room technician, they're the scrub techs, lactation consultants, and then a full neonatal intensive care unit, neonatologists, nurse practitioners, the RNs, and respiratory therapy. They are on the same floor. When you walk to our mother, baby, and labor and delivery, you will actually pass the newborn intensive care unit entrance, so that if a baby needs to pass through there, a mother family is very close. So at this point for NICU, that question may come up. One visitor, generally it's the mother to work on the breastfeeding, and that is changing as well. But if baby's in there, again, they're trying to just protect who can come. At all times, we're open to FaceTime, Skype, whatever sort of device, so that your family members can virtually be there with you if need be. Your providers here in the hospital, a lot of times people like to ask who will deliver the baby. The answer is you will, and we'll be there to help you. We always have on every shift an OBGYN attending, a certified nurse midwife, and a resident. So our OBGYN attending oversees our labor floor, postpartum, and the emergency room, and any gynecological admissions that we've got as well. So they have a really big job. The certified nurse midwives, we are here for labor in particular, and also we can help with the postpartum if questions come up over there. And our residents come from Los Angeles, San Francisco, Tripler, and from UH. They are medical doctors that are working mainly fine-tuning their surgical skills, so they are not considered students. Anytime you see a resident, they will identify their position, and most of the time our OB attending will be there with them also. We, during the day, have a OBGYN that is designated for the postpartum floor. Our perinatologists are always available to us as well. That's Dr. Go and Dr. Ogasawara. They are the ones that you come in contact with for your anatomy ultrasounds. We have certified nurse anesthetist that is designated for our unit. So our epidurals are available 24/7. The main reason you would need to wait for an epidural is if there is somebody else getting one, or if they're involved in a cesarean section. If that happens, generally they have, they can borrow a buddy from another floor from the operating area if need be. It's very rare that you'd have to wait. The NICU team is here and available for birth. If you are here preterm, generally they will come meet with you early just to talk about the expectations of the newborn intensive care unit. The pediatricians are here. The ones that you see here at the hospital will not be the same one that your baby sees in clinic. We have specific pediatricians that are here in the hospital. And students, if we have any students, you will be informed and asked if you are okay having a student involved. So we will all have our badges on, as you can see in that picture as well. Most of our badges will identify who we are also, and it's okay, especially right now when we're all so covered up and we look the same, to really want to look at our badges. That's okay. So I love this picture because look who's in the middle. It's our families that are in the middle there. We're all working around you. It's collaborative practice. We also do shared decision making, which is a catchphrase that midwives are, that's how we're taught, but it has made it into the medical world now, where we present with you the situation that you're in, what the options are, how you're feeling, what your input is, and what do you want to do. Some people will refer back to us and we'll let you know what our opinions are, but we really do honor and respect what it is you want for your own body and your family. And we also agree to disagree sometimes in that situation too, but you'll find that we do that very respectfully. I shared with you that I love how we work collaboratively, and that's part of it, is that you, even if you want something different than what we feel, we're still going to respect that decision. Certified nurse midwives, we are the baby catchers. We do about 70% of the vaginal birth. So if you're pushing your baby out, we're there for you. When I first arrived, there was a very high-risk mother that had several IV poles and lots of things going on with her. But when it came time to pushing, the OBGYN said, Jennifer, I'll take care of all those IV poles. You go do what you do best, which is catching the baby and the delivery. That part's the same. So it normalizes for some of our high-risk moms. It can normalize the actual birth process. So midwives are experts in vaginal birth and promoting low intervention birth, but as that story illustrates, we can shift gears if need be, especially working with our colleagues. I like to remind you too that this birth, your body knows how to do it. A lot of people want that childbirth education. Yes, it's good knowledge, but your body knows how to do this, and you just need to remember and have trust that it does it. With our first babies, it's our heads that get in the way a lot of the times, where we're fearful or anxious about it. So I usually, here's my plug for childbirth education. Approach it with curiosity and wonder as to what your body's doing. And you'll see us, no matter how many babies, I think we counted over 10,000 babies born between those midwives you see on the screen. And each one we still look at like it's fresh and new, because it's always different. So we're well trained to act in any obstetrical emergencies. We suture repairs if need be. And we basically don't stop just with the pregnancy. If you like our care, we are there for you in clinic for your pap smears, your breast exams, preventing your next pregnancy or planning your next pregnancy, and also for menopause. So we do a lot of different hats. So we are fully independent in the state of Hawaii, and that advanced practice registered nurses with full prescription authority as well. So you're in good hands. I think we're all masters prepared as well. So we do have a lactation department that is here. Most of our families, unless breastfeeding is going perfectly, will meet with the lactation consultant. Our nurses at every step of the way are also experts at helping you to breastfeed. Kaiser was one of the first baby-friendly hospitals in the state of Hawaii. We have no longer need to maintain that title because our breastfeeding rates are really wonderful. So breastfeeding friendly meant that we don't give you formula when you leave the hospital. We're not giving you pacifiers. We're promoting breastfeeding with the skin to skin for at least an hour after the birth. We won't weigh the baby right away. We'll delay the cord clamping. Baby stays with you. We don't have a nursery. other than the newborn intensive care unit. And we will not pull out a bottle to feed a restless baby just to keep the baby quiet. We'll actually work with you to hand express, syringe feed, cup feed, or spoon feed if maybe baby's not quite ready to latch. So our breastfeeding rates are wonderful, and anything that we can't figure out, it's usually the baby, so mamas, don't blame yourself if it's not going well at first. If we have a baby that needs a little extra help, the lactation appointments are available to you, and they are free of charge the duration of breastfeeding. We will also, say baby is in the NICU and you can't quite be in there, we will encourage early pumping, and we do have the hospital grade breast pumps for that. So pain management options, you saw the tub that I showed you with the lovely candlelight around. Hydrotherapy is wonderful if you want to be unmedicated for a birth. It just helps take that weightlessness or that weight of the world off your shoulders, and the water helps to relax. You can bring aromatherapy, put in a little lavender oil. The mood lighting is wonderful. Have your own music playing. That tub is available for pushing, though it is not set up for water birth, so we will have you get up and give birth either outside the tub or back in the bed. We have the birth balls, peanut balls. We let you move around, not so much in the hallways anymore, but in this lovely room. You can dance, you can get your music going, you can bring in a yoga mat if you want to, if you see yourself being more on the floor. You can have a doula. Right now, a lot of doulas are on FaceTime with you. Doulas are the spa of pregnancy. They are meeting usually with clients prior to delivery, helping couples to know how to comfort during each other, right? During the labor process. Right now, because it's only one person coming in, most of the time it's the partner that comes along. We have had some women opt to bring in the doula instead. Most of the time, that's when there are other kids at home. We also have IV pain medication, epidural if need be. There's a great video online also from our, I think they were the anesthesia department were one of the first to go for the online class for when COVID happened. So they've made a great little film. Even if you are thinking not to do an epidural, it's still good information to watch that video and understand, especially if it's your first baby, just kind of just knowing it's there for you if you need it. Our epidural rate is around 68, 70%. So it's not everybody that gets an epidural. And the nurse anesthetist is here 24/7. Some families like to meet them ahead of time just to kind of, before labor gets too intense, maybe they want to hear some of the side effects or the whole spiel that they give for consenting before labor gets too intense. Okay, are we having any questions there, Amanda, at all? Everything good?
We're good.
Okay, options for care. So it's your choice how you want to get your care. In the clinics, the Ko'olau, YPO, and Honolulu, we always have nurse midwives, the OBGYNs, nurse practitioner. You can do a combination if you want to. Some of our teacher clients are available, Tuesday at 4 p.m. So they may see quite a few. The way we chart and the way we do our care, you'll find it's very fluid between multiple providers. We all have access to your records. Yes, our personalities are a little different, but the way the care that we give is very similar. Sometimes it's nice just because on the labor floor, our shifts are varied. So it is for midwives, we're 2 days a week here on labor and delivery, usually 1 day shift, 1 night shift, and 2 days in clinic. And our physicians also have a schedule where they're in the hospital and also in the clinic. So sometimes it is hard to see one person, but the benefit of that is you've got great minds, right, that think alike. So you have a team of people that are looking after you. And I told you that the whole thing of this class is because of how we work. And that team aspect is amazing. When I worked private practice and I was on call for my clients 24/7, that is hard to have one person. And if I'm tired because I've been up with a birth and then I went to clinic, I was always worried that I could miss something. The way we work, it's rare that things are missed because we've got multiple layers and multiple people that are looking after you. So it's up to you. With COVID, we are also offering a check-in by telephone if you want. Obviously, we'd like to know what your blood pressure is. So if you have a blood pressure cuff at home, and if you are 28 weeks or more, we'll check in on how well that baby is moving. So the benefit of COVID is that we've got you to check in and you come in and tell us how you are instead of coming in to find out how you are, if that makes sense. We're trying to shift the way we give care so you wouldn't have an ultrasound and a visit on the same day. Those two things can be separated. So we are willing to see you as often as you want to be seen, or we can space out those visits too if you feel more comfortable with that. So talk to any of us about that and we can help you rearrange your schedule as need be. So generally the schedule of visits is monthly until 28 weeks. At 28 weeks, we shift to every 2 weeks. And then that final month, we're going to see you weekly. Extra appointments are always available if need be, or like I said, if we want to back off on some appointments because of COVID also. Urgent care is Monday through Friday at all the clinics. There's a physician that is assigned almost an empty schedule so that they can have spaces for you to come in for appointments. There's after hours at Moanalua Medical Center. However, if it's pregnancy related, they're going to be very nervous. We are not there, but we are here labor and delivery. So feel free to call that number 432-8552 and check in with us. We can answer a lot over the phone, or if you need to be seen, we'll let you know, or if it's something that can be seen in clinic. New to our kind of full care as the Mother Newborn Clinic. I think it's been about 2 years now that we're running that. When you are discharged from the hospital, you will have an appointment within 1 to 3 days for evaluation of you and baby by one person. That is a phenomenal way to see how your blood pressure is, how are you emotionally with the sleep deprivation, how much weight is baby gaining, how's the breastfeeding going, and they can cover all of those things. There's a lovely video also online that John will probably post, the story of baby Kai, and it was a catch at that Mother Newborn Clinic of a baby that actually had a temperature prior to COVID, but then just the steps that went from just that little tiny fever and investigation of that baby. And the story, nobody wants that story, but the family was just, they tell it well and very grateful for the transition to care with baby going back to the NICU. That are happening for you. First trimester, we do a whole panel of blood that's testing 3 antibodies. So with COVID, they're still looking at antibody testing. The antibody testing that we're familiar with that does show immunity are to rubella, chickenpox, and the measles. So we will test you for those 3. We do a full STD panel. So that's chlamydia and gonorrhea, hepatitis B and C, HIV and syphilis. We'll order a drug testing, which we do for everybody. We'll do your pap smear if it's due. We'll test for diabetes early if indicated. We'll order a dating ultrasound, usually around 8 weeks is when we can best see what's happening there with that early gestation. We also offer early screening for Down syndrome and other chromosomal disorders. So that's between 11 and 14 weeks. But after 15 to 20, there's another test that can be done that's called the quad screen, looking at different hormonal levels in your blood for abnormalities that then trigger more testing for you. Keep in mind, screening tests mean who needs more testing. A diagnostic test would be the next step from those. Your anatomy ultrasound is between 18 to 20 weeks at Moanalua Medical Center. That's where Dr. Go and Dr. O. Our perinatologists are involved in even our healthy and well families. Third trimester, we'll do diabetes testing and check for anemia. And then there's a swab for group B strep that's done between 35 and 37 weeks. I think we have a couple people that are 33, 32, so you'll be getting that test done. Group B strep is a bacteria that lives in our vaginas. It doesn't usually cause us any problems. We don't know why it's there, but it's there in about 30% of us. It comes and goes. So we test at 35 to 37 weeks. If we find it, we treat you in labor. So it's one of those things that's just part of our body. So there's no need to find it and treat it early. But in labor, we give you penicillin through an IV. If you're allergic to penicillin, we have other antibiotics that we'll use. And that way it gets the bacteria out of the vaginal canal. So when baby's born, they're not exposed to it. Group B strep is a powerful bacteria for newborn babies. And so we're learning more about that, but we have learned to screen for it and treat for it. So on admission, I also mentioned that we'll be doing the COVID tests. At this point, it is a nasal swab, and we're also checking your blood type, looking for anemia, and we're checking for syphilis when you come in as well. So each visit, there is a rhythm. We do your blood pressure. Whenever we collect your urine, we're looking for protein and glucose. So just so you know, if you have a bunch of sweets before you come in, we might find glucose in your urine. So a healthy reminder to eat well, because we'll be spying on your urine. We'll check your weight, which we'll talk about in the taking care of yourself. Just kind of one of the best things for your pregnancy is to actually watch that weight gain. We'll check the fetal heart rate with the Doppler. We'll review your labs and ultrasound, especially addressing questions and concerns. And we'll be giving you the COVID updates and check-ins as well as things change. Ultrasound, you get the dating ultrasound, usually 8 weeks. Then an anatomy check at 18 to 20. Most healthy pregnancies, that's all you'll need. If there's your tummy is growing maybe too big, too small, we will order another ultrasound. If baby's not moving as much, we can also do a non-stress test and amniotic fluid index just to look around the fluid of the baby and put you on the monitor. So those are if there's concerns. Other reasons for more ultrasounds are elevated blood pressures, diabetes in pregnancy, or decreased fetal movement. So ultrasounds are not necessarily the be-all, end-all in fetal well-being. The best person to tell us how baby is you, and paying attention to those patterns and changes. Okay, any questions as we transition into that?
So Jen, there's a question about finding the due date. Is that, when are they going to determine when the exact due date is?
Oh, great question. So that dating ultrasound, we'll compare that if you know your last menstrual period. That's how we date the pregnancy. And so there's lots of apps on the phone right now that you can wheel it out, is what we call it. That's one of the things at your first visit that we're going to calculate with you. And then we compare that to the early ultrasound dates. If they're about the same, we'll keep usually the last menstrual period, that date that we calculate from that. If it changes, that's the due date that we'll stick to. So later on in pregnancy, we will not change your due date, either one of those, early ultrasound or your last menstrual period, and we'll be communicating to you. Usually at the dating ultrasound, she'll set that date with you. And Amanda, do you have anything else to add about our pregnancy care, how we work?
No, I think you covered it all.
Okay.
Just that we're awesome.
Time anytime. Okay. So again, we're not doing group exercise classes. I looked at this picture this morning and went, oh, my heart breaks. I wanted to paint on little masks, but that wouldn't even work because our gyms are closed. But this next section, we're going to talk about healthy pregnancy, medications, herbal remedies. We'll talk a little bit about vitamins, a lot about nutrition and exercise. My favorite part is the stress reduction and management. We'll go through some mental health things, especially right now with COVID. There's a lot of anxiety, intimacy, relationship struggles, travel, and dental care. And I know that travel seems really sad to talk about right now too. You're not alone in missing that. So medications. Tylenol is generally okay. Reasons to take Tylenol is if you have a headache, if you've got a little aches and pains, maybe a sore back. We will talk about that care. Asthma medications are okay, especially right now with COVID. Looks like the COVID virus entry is through the lungs, so making sure your lungs are really healthy is important. If you are somebody who rarely uses your inhaler, I would make sure you have one right now, especially if you get sick, that you don't have to scramble and pick one up last minute. Most of the time we can do that for you, or you can do that from your primary care provider, either an email or a phone call, or if you have not seen them in a while, go in and see them. Asthma is one of those things that you do need to, you are the source of your baby's oxygen, so you need to have good working lungs in order to supply that oxygen to your baby. Thyroid medications are okay. Antidepressants, we would rather that you have a conversation with us before you stop them on your own. Most of the time you can stay on antidepressant, work with us or your provider that writes that prescription for you. We do want you to avoid ibuprofen or Motrin. Treating colds and flus, you want to avoid the multi-ingredient products like NyQuil, Theraflu. You would rather treat your symptoms. So if it's a cough that you have, use cough syrup. If it's a throat issue, I actually have it with me, some throat spray you can use. If it is a stuffy nose, you can do a decongestant, the neti pot, or those nice steams to open up. Vicks is okay as well. Over-the-counter products, they're not always the same, so check if it's okay. And on kp.org on the desktop, on your computer when you log in, on the far right side, there's health and wellness. And when you scroll down, there's actually a herbal remedy encyclopedia as well as medications that you can check too. I would not Dr. Google right now. I would stick to kp.org and look at things there.
Jen,
yes.
How do you feel about topical CBD oil?
That's a kind of an unknown right now. It's a really good question. The state of Colorado was the first state to legalize marijuana, and so the research of the effects on pregnancy is amazingly strong, saying especially the THC is not good for babies when a mother is pregnant. Most recent article was autism, risk for autism. Other articles have talked about low birth weight, also NICU admissions, preterm labors. So generally, the CBD, I haven't seen it associated with the THC, but I'd be cautious because it's so new and it's not regulated. also. So you just have to be careful with that. If it's CBD oil for pain, I would rather that you rub into your back a sports cream like Bengay, or Arnica is also a good herbal supplement that is okay in pregnancy for bruising, different things. Good question. Anything else? So healthy lifestyle choices are important right now. We have Regan Turner Bell as one of our certified nurse midwives who is there for our mothers that may have addiction. She's beautiful in her approach to care. There is not judgment, but discussion and where can we meet you and what can you do? So please do let us know if the alcohol or drug use is an issue. Same thing with smoking right now. Cigarettes are easier to quit than vaping, but we would love to help you with either one. Again, this is a massive pandemic where it seems the point of entry is our lungs. So right now, anything that we're putting in our lungs that could be harmful could put you at more risk for severe COVID. So Kaiser has a whole team of people that are going to help you quit. If it's tobacco, we will, smoking cigarettes or vaping, and the nicotine is usually very highly addictive. The gum, patches, quits line, we will help you with that. You also want to be very cautious with secondhand smoke right now, and caffeine you want to limit. So Kaiser has health coaching that's available. I think tonight from 5:30, 6:30 was the first class that they're teaching also to talk more about healthy lifestyles in pregnancy. It is also once a month. I think on Wednesdays, the last Wednesday of the month. So look for that. We have it posted in the clinics also. But a health coach is somebody that can help you make a change that you need to make, and they'll help you figure out how to do that. But sometimes we get stuck in the, I just can't lose any weight, or I can't stop smoking, instead of flipping the switch on our brain. Herbal remedies, again, ckp.org. Right now, boosting the immune system is something people are interested in. Vitamin C, the airborne, the emergencies, those are okay. Just follow the recommendations. So you're not overdoing it with vitamin C. You would just key that one out, but it's just kind of wasteful. You can do echinacea, garlic tablets. For those of you that are early along, that red raspberry leaf tea is good for the nausea, vomiting. I do have a slide that will address nausea, vomiting, so we'll get there as well. You want to avoid unpasteurized remedies like apple cider vinegar, kombucha, raw honey. Those things can just have extra bacteria in them that your body doesn't need. So vitamins and supplements, the main recommendation is the prenatal vitamin, and it's for the folic acid that is good for the baby's brain development. The recommendation usually is for consumption of that prenatal vitamin about 3 months before you get pregnant, if you were planning your pregnancy. Thankfully, in this day and age, our flour, breakfast cereals, oatmeals, most of them are enriched with that extra folic acid. But a prenatal vitamin is good to continue all the way through your pregnancy and breastfeeding. The chewable ones are a little easier to tolerate because when you swallow one of the vitamins, sometimes they can upset your tummy. So what my recommendation is, get a prenatal vitamin that you will take, that you like, and is affordable. So I tried an organic one from like a Whole Foods where I had to take 3 tablets 3 times a day, and yeah, I didn't take those because that was just too much. Plus I was paying a huge amount of money for them. So just Costco is fine. Early on, if your nausea, vomiting is significant and you think that prenatal vitamin is tough, that's okay. Just don't take it for a while. There are worse things you can do. It is one of those things that we don't want you to be suffering because of taking it. You could consider calcium, omega-3, DHA, B complex, vitamin D. Vitamin D, especially right now that we can't be at the beach, that's a good one to supplement. Again, chewable is fine. If you can get through your pregnancy where the only sweet that you have is your daily prenatal vitamin, you're on your way to an incredibly healthy pregnancy. That would be really good. So nutrition, I think this is worth spending some time thinking about, evaluating, and just being mindful and present with what is your food like. I know we talk about the COVID-15 right now, and we're about ready to go and be home for a long time. Just be very careful for that easy access to food, especially if you're working at home right now too. That get up and take a break to go to the fridge and get food might not be the best break. We'll talk about other options for taking a break. So pregnancy is a time of making the best food choices that you can. Take a moment before you bite to be mindful. Is this nutrition for me and my baby, or is this pure pleasure eating? If it's pure pleasure eating, make another choice, because you want to make every calorie give your body and give baby something. So if it's Twizzlers or a soda, there's no nutrition in there and it's just extra calories. So you only need 200 calories per day while you're pregnant. So like a cup of yogurt or a banana with some peanut butter, carrots, and hummus. So 200 is not a lot. You want a colorful plate. So there's a brochure from our dietitians that says eat the rainbow. And so that's picturing, actually you can see it in her salad there, the greens, the purples, the yellows, oranges. Fruit has lots of color to it, so eat the rainbow. Protein, meat, eggs, dairy, tofu, and beans. That's good for muscle development. Does not always have to be meat. You can be a plant-based diet and still get enough protein. Veggies and fruits would be half of your plate, more veggies than fruits. And carbohydrates are the things that you want to cut down, especially your white rice and your white breads can tend to be lots of calories with not a lot of nutrition. So staying away from party food. So right now there shouldn't be any parties, and definitely not more than 5 people if there is a party. But a lot of times what's happened in our American diet is that we've gone from party food to party foods becoming everyday foods. So just really be mindful of that. They tend to be really low in nutrition. Same for fast food. My sons and I did a science experiment. They got a McDonald's Happy Meal after a soccer game, and we took out the cheeseburger and we unwrapped it and we left it on the counter from April until September. We didn't move it, we didn't touch it, we just watched to see what happened, and it dried out, but it didn't mold. The bugs didn't get to it. There was no smell. So that kind of is an indication that a cheeseburger at McDonald's, it's not food. There's preservatives in there. So just be mindful of that. If you are eating out, you choose a spot that's got lots of vegetables. You'll want to avoid greasy fried foods. Avoid your cakes, cookies, your chips, your sweets, soda, and juice. So beverage choices that are wonderful are things like sparkling seltzer waters. If you are somebody who likes that little sweet of juice, cut it down with the seltzer water. Sometimes that'll help. Foodborne illnesses. We've all heard about the rat lung in Hawaii, salmonella on some of the romaine. Just be aware that COVID is not our only bug. There were 4 foodborne illnesses that were out there too. So things that can cause foodborne illnesses are raw meat. So we do ask that you not eat sushi right now, poke, deli meats and salads. A deli sandwich from Subway, you would want to have a grilled sandwich right now, not cold deli meats that sit out for a while. You can microwave them just till they're steamed. You also want to avoid the unpasteurized cheeses, unpasteurized honey, juices, and milk. The real wonderful moldy cheeses are the bries and the blue cheese. You'd probably want to avoid those also right now. Again, if they're warmed, probably better than having them like on a salad. Any questions about foodborne illness? I know we forget with COVID that those things still exist. So water is so important.
Question.
Oh yeah.
What about fresh spinach in a smoothie?
Oh, good. I forgot to mention that. So any of those bagged lettuces or romaine lettuce that says triple washed, you're going to want to wash that again. So before you put it in your smoothie, just make sure you've washed it off, even if it's pre-washed. So a good way to do that is a salad spinner. That way you can just, that they're like a little sieve, and then you can spin it around to dry it off more quickly. Some Whole Foods Down to Earth, they also have some little drops that are more citrus based that you can put into the water to wash those things too. So before you make a fresh smoothie with fresh spinach, make sure you've washed it. Good question. And even the frozen spinaches right now, I would not put those in your smoothie because you can't really wash that. So water is important. I love that image of thinking about inside your baby's floating in water, right? Our bodies are about 70% water, which I think is not an accident. The earth is about 70% water as well. So your baby's floating in there and all that amniotic fluid, and our bodies need water. Water is the only beverage actually that you do need, and 2 liters per day is the recommendation. I think having a fancy water bottle is always good when you come in labor, one that is pretty to look at, but also makes the water taste good for you. If you're not a water person, then think about adding lemon or lime, fruit infused. Try a little sparkling water. Mint and cucumber is good. Basil is also a really nice one in water too. And be cautious because it is possible to drink too much water. So if you are finding that you're drinking 2 liters, but then you're having more and more, talk to us about that because we want to know what's happening. So our dietary services have also shifted a lot of their classes online right now too. Get your plate in shape, Viva Veggies, Healthy Kids, Healthy Families. Again, on the desktop of the KP website, kp.org, there's the health and wellness. You go to classes, that's where you're going to see what's available. We have moved to all online right now, or resources for you that are online, and that kp.org has a lot of information. You can meet with a dietitian, usually by phone or video visit, by calling the 432-2000. It is self-referral. You don't need a referral from us. And we also have, for your after visit summary, we can list more information on there for you to reach the dietitians or the life coaches. So exercise in pregnancy, you do, not in a group like in this lovely picture, but you do want to spend about 30 minutes per day doing some type of exercise. Kaiser has gifted us several things to keep us healthy during the pandemic. One of the things is the class pass. So if you go on kp.org, put in class pass, you can look at that. There are over 4,000 exercise videos that become available to you on that app. And there is a gentle prenatal yoga that's on that app. And I think some other prenatal ones also. So whatever bit you've been doing, generally you can keep doing, but it is not time to compete. And as if you are somebody who likes to run or jog, you may notice the round ligaments will inhibit further jogging as you get further along. A belly band or support can help with that. Walking is amazing, doing the goal of 10,000 steps. Kaiser's also gifting the Fitbits. If anybody's done the Active and Fit gym membership, right now gyms are not recommended. especially in pregnancy, but they will send you a free Fitbit or other device you get to choose. And then if you get in 45 days of 10,000 steps, you get a reward for that. So I highly recommend looking into that. If you haven't, we are September, so in theory, you could get your 45 days in. Prenatal yoga is amazing. You'll want to avoid high-risk injury sports right now, anything that can make you fall. I know we've got surfers out there. I know our ocean is the only thing that's open right now, but surfing is one of those things. If there's too many people around you, surfboard injuries, or for your own self for falling. So just be mindful. Stand-up paddleboard on still water is probably just fine. There is physical therapy that is self-referral through Kaiser 432-2000. That's good. We'll talk about back issues. That's really good for those back issues. Or if you've got carpal tunnel, you can call and make those appointments for yourself. And they've shifted a lot online as well. So my favorite part of this class and for life in general is just spending a moment to talk about stress reduction and management, especially during a pandemic. That is huge. And it's hard for our human brains to take in the scale of what's going on. And it's frustrating to see the science going through different studies and trying to learn kind of out loud what is all about this virus. For stress reduction and management, the core essential things are sleep. Don't underestimate the power of sleep. The combination with exercise, mindfulness, and meditation. So again, on kp.org under health and wellness, there's a section of podcasts. There's also some guided relaxation. Take a look at those. Kaiser is also gifting all members a year of the Calm meditation app, which is daily calm. They have like a 10 or 12-minute meditation that's available. And then there's several different classes. I believe there's some pregnancy-oriented ones on there too. And then a mental health app that's called My Strength. And when you sign up for My Strength, it will go through a series of questions that will help tailor the app to what your needs are. So look into those things. Again, remarkable that your health insurance company is gifting these things so that you can learn how to take really good care of yourself. So stress reduction and management with the meditation and the mindfulness is the part that I'll focus on right now, and we'll spend a little bit of time on this slide. Just talking about our stress response, the sympathetic nervous system generally increases our heart rate, our pulse, our blood vessels constrict, our blood pressure increases. We tend to breathe more shallow. Our muscles get tense. You know, that neck pain that you get comes with stress. And our skin temperature actually drops as well. So when you have a relaxation response like meditation can do for you, or mindfulness, our heart rate actually decreases, our pulse decreases, our blood vessels dilate, something that you want, right, in pregnancy, so that nutrition and oxygen can travel to baby. Our blood pressure drops. By being relaxed, the parasympathetic nervous system helps us to deep breathe through our abdomen. Helps increase our digestive action. You know, when you're stressed, things just kind of, and you eat something, maybe you eat fast and then it just sits in your tummy. So when you're more relaxed, your body can actually digest better. Muscles relax and our skin temperature actually increases. So that skin temperature is fascinating with the skin to skin after the baby's born, right? We want baby for stress reduction to go on you and stay there for at least an hour. And it actually helps you relax. So our mamas that might have blood pressure issues, that skin to skin with their baby actually helps everybody to relax a little bit more. And if you think about it, the more relaxed you are with after working so hard to get the baby there, your skin temperature will meet the needs of the newborn baby. It's pretty impressive. So I'd like to spend a moment just to do an introduction to meditation. So if you all want to turn off your videos so you don't see yourselves with your eyes closed, that's fine. But if your eyes are closed, you can't see everybody anyway. Meditation is a trial. It's something that you're just trying to clear your brain. It also gives you a chance to tune into how you talk to yourself. Are your thoughts reassuring? Are they encouraging, or are they self-destructive? And sometimes we don't even pay attention to how we talk about ourselves because we're rushing through the day. But with COVID, there is increased stress and reduction and a little bit more time to actually hear our own voices inside our heads. So I invite you to do a trial of meditation. I'm going to actually take you on a tropical beach meditation, since we're all missing the sand between our toes and laying in the warm sun. So find a comfortable position. I'll walk you through this. Close your eyes. Maybe resting your hands on your lap, feet flat on the floor. And just take a moment to tune into your body right now. How is your breathing? Are you breathing fast? Deep? And just feel your body. How are your shoulders? Your neck? Is your brow wrinkled up? Can you let your brow go relaxed? Tune into baby. Partners, if you want to feel comfortable putting a hand on her tummy, you can feel. How about your hips? How's your posture? Recommended when you're doing a meditation that's sitting, that you sit a little bit more upright, supported, and sitting up straight and paying attention to your posture. You can actually take a much deeper breath. How is your pelvis? Can you squeeze your pelvis a little? Root strength there. And then can you relax it? How about your joints, your hips, wrists, knees? How do they feel? And toes. Can you actually feel what's beneath your toes? The carpet or the floor? Shoes? Now, as we start to take some nice deep breaths, paying attention to how your body starts to change. So breathe in through your nose, out through your mouth. Maybe make a sound if you want to. Ah. And on your own, just do 2 or 3 nice deep breaths. Through your nose, out through your mouth. Can you feel your body unwinding? And just take a few moments to pay attention to what's happening in your head. Are you judging yourself? If so, tell yourself to knock it off. Just enjoy, just be in the moment. Are you looking at the clock and wondering how much longer? When do I go to bed? What's going to happen after midnight? Just let those thoughts go away. You visualize clouds. Put it on a cloud, let it pass by. Sometimes if your mind is too active, just focusing on Breathing in, breathe out. Some people will count. Sometimes you can say, breathe in calm, breathe out peace. Whatever works for you. There's no judgment. There's no right or wrong. It is just what it is. So now we'll go to the beach. So with your eyes closed, imagine yourself walking along a pathway. You come to the sandy beach and you look at the glittering turquoise ocean in front of you. You can hear the sigh of the waves that they break on the shore. Feel the warm sand beneath your bare toes as you walk toward the water, with the sun caressing your face. As you come closer to the ocean, you can smell the salty aroma of the ocean. Maybe you taste it on your lips. Now take a moment to walk into the surf, feeling the coolness of the waves as they wash over your feet and ankles. Maybe you go in farther, letting yourself be submerged by the water as you lift your face up to the sun. Maybe turning on your back and floating with your arms out. Can you feel the baby moving as you do this? Kicking with your feet. That cool, refreshing water as you take a dive underneath the sea. And when you feel refreshed, leave the water and walk back up the sandy beach. Well, this is the part we've all been missing. Find a place in the dunes to lie down and rest, feeling the warmth of the sun on your body, the softness of the sand supporting you. You're able to let go and relax completely in this beautiful place. When it's time to go, get up slowly. Trace your way back to the pathway. Walk away from the beach, knowing you can come here at any time. Slowly bring your awareness back to your present surroundings. Open your eyes. Try to keep the same sense of softness and relaxation with you. To the benefit of, welcome back everybody, the benefit of learning that type of strategy is in labor, right? It will help as you have a contraction, how to go about it with curiosity and wonder, like I said, not be so afraid, to keep that relaxation in your body. And it also helps when you've got a newborn baby that's crying. The more calm you can be, your little energy magnet of a baby will also be more calm. Thanks, everybody. That was wonderful. Any questions from that? So counseling, oh yes, is Amanda there? Yep. So counseling services are self-referral at Kaiser. So maybe if we did that exercise and you found that there was some things in your head, maybe some fears, some anxieties, or it was just really hard to settle down, think about counseling. They're doing a lot of telephone and video visits also right now. Pregnancy is a huge life change. A pandemic is a huge life change. Our economic situation is a huge life change. So sometimes talking with a counselor can be really healing. Mental health will help with ADHD, anxiety, stress, autism, bipolar disorder, depression, eating disorders, the obsessive compulsive disorder, which during a pandemic kind of comes out of all of us, sleep problems, and substance use or disorder. So those are all reasons to approach a counselor. So that 432-7600 number is an initial triage appointment. So call and be somewhere you can talk quietly and openly share. And they're not just listening, right? They're going to give you tools too for how to face life. So intimacy in pregnancy. So let's talk about sex, baby, right? Sex is okay in pregnancy unless otherwise advised. That said, it needs to be a mutual thing, and it changes. Your body image changes in pregnancy. Your partner's relationship sometimes can change. Sometimes women are more interested and men are fearful. I do find, as a certified nurse midwife doing this for over 20 years, that it is a tough thing to talk about sex with the person that you're having sex with. So just be mindful of that and find that common ground. There is counseling for couples also that is available through Kaiser. Before COVID, we had a lovely, I think it was 6 or 8 week couples communication class. Right now, I think there's more of that available online too. But sex can generally be okay, especially if you're getting towards your due date or beyond. Sometimes the same way baby got in there can help get it out. So with that intimacy, there can also be relationship struggles, especially with all the stressors we listed previously. Everyone deserves a safe relationship. And generally for a woman, it takes 10 times of asking before she'll talk openly about her situation. Pregnancy is a high stress time, so you're at more risk in pregnancy to face violence in your relationship. There is help. I think this isn't just a women's issue. Sometimes it's talked about like a women's issue, but it's all of us, especially during COVID and people being home. You know, if you hear the couple arguing next door, your neighbors, you see something in the street, sometimes it is worthwhile just to check in with both people. How are you doing? I could hear your voices. Uncle or auntie who seem to have passionate fights in front of your children, maybe pulling them aside and having another conversation with them. So it is worthwhile. So on the screen, there are links to the National Domestic Violence Hotline. You can talk with us at clinic. There's also kp.org. There are resources that are available. Dental care is important. Infection in your mouth can travel through your bloodstream to your baby, so we do want you to get a good dental cleaning, sometimes twice in pregnancy. Dentists, if more needs to be done, they may want a release from us, which we're happy to give you. All of our nurses at the clinics can actually write those letters for you. You want to brush and floss regularly. You may notice your gums bleed a little bit. And it's okay to get I have a couple of clients that need cavities filled. I would suggest getting that stuff done. Routine x-rays, they probably won't do for you, but if there's an issue, they'll look into that. The reasons to call. Anytime you're concerned, so are we. So bleeding, vomiting so much you can't keep liquids down. If it's after 28 weeks and you can't feel the baby move as much or something's changed, if you've had a fall, if you've been in an accident, definitely reason to call. So after hours, labor and delivery, 432-8550. During business hours, you can call your clinics. With COVID exposure, we talked about it before we started the presentation, 432-2000 to get in touch with your primary care. I tested the system not too long ago, and I was pretty impressed with how quickly I could actually get into a real person. And I had to confess that I was just a secret shopper, right? I just wanted to be able to let my clients know that somebody would answer that phone. And I did talk about kp.org, the app on the phone. There's the e-consult. So when you open that app, there's a yellow banner that says COVID-19. When you click on that, you can start an e-consult. So it goes through a list of sore throat, runny nose, fever, cough, loss of taste or smell. There's a whole list of things that you can check off. Exposure is one of the things as well. So that's an initial start. If you would like to, you can look at that. Discomforts of pregnancy. So first trimester, I think we've got about half the class that are first trimester. So nausea, vomiting, fatigue, back pain, breast tenderness, and discharge can all be changes that we call them discomforts because they're not worries, but they're not comfortable either. And it's definitely changing of your body. So for the nausea and vomiting, most of you will learn that it's not just morning sickness, that it can come at any time of the day. Most of you will learn that there's more aversions than there are cravings. So generally, if you feed your cravings and avoid your aversions, you won't have as much nausea, vomiting. That's tuning into your body, right? You can wear those acupressure bands. Those help. The motion sickness will help. You can do a B6. They're 50 milligram tablets. You cut them in half and take it 3 times a day, and combine that with a Unisom, which is over-the-counter sleeping medication that's safe in pregnancy. And you take that at bedtime. That combination of the B6 and a little deeper sleep can help prevent or keep the nausea manageable. So those 2 things are to do on a daily basis. They're not something to, oh, I have nausea, so now I'm going to take. So take them regularly. Other tricks that you can do is small frequent meals, feed your cravings, lemon and water, pasteurized apple cider vinegar, adding a little bit more stomach acid, acid to your stomach seems to be the trick with the vinegar. If it's bad, then stick to what's called a brat diet. Bananas, rice, applesauce, toast, oatmeal, cream of wheat. Boy, those things usually don't come up. You can do sipping on red raspberry leaf tea. That can either be chilled or hot tea, whatever you like. And ginger anything tends to work. There's some lovely ginger chews you can get, ginger tea, ginger in curries, whatever can help with that. We're also available by email or contacting the nurses if you've got questions about nausea, vomiting. You'd want to call in though if you just can't keep even water down. So fatigue is common, usually first trimester and second trimester, a little bit goes away, and then third trimester it comes back. You are growing a baby, so that takes a lot of energy. So that's okay. Just keep reminding yourself that. Sleep is a great way to combat that. And again, the Active and Fit membership with Fitbits or some of the other exercise devices will actually track your sleep for you at night also. You'll want to go to bed and wake up on a regular routine. Naps are okay at any time, especially if you're working from home right now. That's kind of a nice, convenient, I'm gonna go take a nap instead of get something out of the refrigerator. Mindfulness, meditation, daily exercise, healthy, nutritious eating, and avoiding heavy, greasy, fatty foods are also ways to combat the fatigue. The Calm app has sleep meditation and bedtime stories that are on there. And they're bedtime stories where the voice, a lot of them are famous voices. They're reading to you nice and strong. And then the words will get slower and softer. And most people can't even finish the stories because they're asleep beforehand. With sleep issues, you'll want to make sure not to be looking at your screen. Generally, the advice is 2 hours before bed. That blue light from our computers or our phones triggers our brains to think it's a blue sky outside and it's daylight. So with the Calm app, that's something you can have the speaker in your room and listen to. Back pain is part of pregnancy. You can see with this woman, her posture. You can see the weight of the baby up front makes her back kind of sway a little bit more. Those balls are fantastic. So if you are binge watching something, I would rather you sit on a ball rather than the couch. We're seeing a lot more babies that are not in perfect alignment to come underneath the pubic bone, meaning they might be looking sunny side up or just a little crooked, where they need, their back needs to be towards your front to come under the bone. Sometimes we're wondering if that's because of our sitting back, not so good posture, sit on the edge of a chair, legs open, with your tummy kind of free, and that will help. When we lean back like that, our babies tend to not get in good position. So prenatal yoga, massage, chiropractic, acupuncture, those things can all help. And again, our physical therapy department is available to you at 432-2000 just to make an appointment. They're doing, again, more online video visits as well. Breast changes are totally normal, getting ready to breastfeed. You may notice tender breasts, skin changes, darkening of the areola. You may have some leaking that starts from the breasts. You may need to get a couple of different support bras during the pregnancy just because the breast may change. There are pregnancy bras, there are nursing bras, maternity bras. Go have a look. In that same section, actually, from the last slide with back pain, you'll find the belly bands as well. I would recommend getting a belly band as your uterus gets a little bit bigger. It just helps lift baby off your bladder, off your blood vessels, and makes you feel more comfortable. It helps support your back.
Hey, Jen, real quick. Tips for hand and feet swelling late in pregnancy.
Oh, yes, very good. Limiting your salt intake. So right now, the takeaway food is so tempting. And as we all go and buy hurricane supplies and our quarantine supplies, a lot of them are pre-packaged products. Simon, they all have a lot of salt in them, so be really aware of that. Exercise, water, elevating your legs, get somebody to rub your feet for you, compression stockings. Those are all helpful for that swelling. Do you have anything to add to that, Amanda?
I think you covered that pretty well. I like the massage and the compression stockings.
Yeah, so compression stockings, there are hospital grade ones that are available in our gift shop. You can talk to us about those. The gift shop here at Moanalua, you can get them online. There are a lot of running socks right now that would be great. And then Long's, Walgreens, they also sell the over-the-counter compression hose. Some of them are quite fun little patterns, so they've gotten creative with them. Okay. So discharge changes. As your cervix is nice and closed in pregnancy, there's a little plug that's developing, the cervical mucus plug. And that plug is constantly remaking itself in pregnancy, so you will have more discharge. A white milky discharge that doesn't bother you odor-wise or irritation. It's bothersome because it's just a constant moisture, but that's generally normal. Things that would concern us and we'd want to know about are vaginal itching or irritation or odor, a yellow or a green discharge. If there's a pink tinge to it, or if you think your water has broken, leaking a fluid, watery discharge that doesn't quite smell like urine. So those would be all things to check in with us about. Okay, so kp.org, a wonderful way to communicate with us. Emails take about a 3-day turnaround because if we're off on the weekends, it's a chance to, we're not always looking at them on the weekends. And the nurses aren't in the office too. So email is good if it's not urgent. If anything's urgent, we do want you to call. But on kp.org, you can look at your test results. There's endless resources on kp.org. And the reason I say go there first and search is because it's all been researched by our national Kaiser, basically. So there's not usually confusing information that's on there, and it'll be very similar to what we're telling you as a department as well. When you go on Google, there are too many websites that are I don't know what the accuracy is of them. So I would prefer you use the kp.org. E-consult for the COVID is fantastic also, that's on there. Okay, so there's our conclusion.